According to Legal Terms Dictionary, physician-assisted suicide, also known as active euthanasia, comes from the Greek term good death. It is defined as the act of killing a terminally ill patient out of concern and compassion for their suffering. Types of terminal illnesses are Lou Gehrig's disease, AIDS, and types of cancer. This problem may not hit home now, but imagine years down the road if you or a loved one were diagnosed with a terminal illness and only had 6 or less months to live. This would leave you with nothing to look forward to except the absence of quality of life, depression, unbearable pain, and embarrassment. And all you want to do is for the suffering to stop. But that's not possible because the government has taken away your right to choose about your own life. Physician-assisted suicide should be legalized in all 50 states. It can be controlled by laws that protect its abuse while alleviating patient suffering nearing death, and will help the terminally ill exercise their freedom and rights to choose death. Terminal illness is a common diagnosis. You may know or eventually may know someone who will have this happen to them. Only 2 states allow physician-assisted suicide, and that's Oregon and Washington. Thousands will suffer from terminal illness in the other 48 states that do not have a voice about their own existence. My profession requires me to be with patients who have terminal illnesses. And if you've seen anyone suffering from a terminal illness, it is a horrible thing. I will be explaining why terminally ill patients should have the right to choose about how they spend the last days of their lives, and how you can make a difference in these people's lives. Physician-assisted suicide needs to be legalized in all 50 states instead of only 2. Laws need to be passed in order to provide rights and freedom of choice for the terminally ill. Fast Access wrote a story over a 30-year-old mother dying of Lou Gehrig's disease. She begged and pleaded with the courts to let a physician assist her in suicide, knowing that one day all of her muscles will eventually deteriorate and she would choke to death. The courts would not help her, so she went to her doctor. He broke a law and gave her medicine to commit suicide. This could have all been avoided if there were laws with safeguards helping the terminally ill answer their wishes. Statistic Brain states that 55% of terminally ill patients die in severe pain. And that leaves the other 45% who are in moderate pain. Growth House estimated 1.2 million new cancer cases are diagnosed in the U.S. annually, and that means 100,000 new cases each month, which means 25,000 people are diagnosed with terminal cancer each week, and around 3,572 people each day. That's only one type of illness we are accounting for. Donate and support funds working towards changing the active euthanasia laws. There are several funds online that work towards changing and honoring these euthanasia laws. Supporting, funding, and spreading the word about these organizations will help make a bigger impact. Donations to this foundation have passed and defended bills such as the Death with Dignity Act. Member contributions helped them pass a new Death with Dignity Act in Washington and defend the current Oregon law. These foundations provide education and outreach programs to help further legalize physician-assisted suicide to the terminally ill. Millions of people die every year with no quality of life or dignity due to not having the right to choose about their own ending. The laws that have passed help honor the terminally ill patient's wishes to choose their own fate. If these laws are changed now, people will have the right to choose not to suffer. Terminally ill patients will finally have a voice of their own, and they can die with dignity. Terminally ill patients can choose their own fate, and if these laws remain the same, terminal patients have no voice of their own, will never have a voice of their own, and will continue to suffer. Donate to current, past physician-assisted suicide foundation called Death with Dignity National Center. This center provides information, education, research, and support for the preservation and promotion of death with dignity laws. Supporters can donate to the foundation online, by mail, or by telephone. All of their contact information is located on the Death with Dignity National Center website. Help give a voice to the people who cannot speak for themselves. They may not have control over their lives at the present moment, so help give them control over their future.